Welcome back to another edition of Animal General with me, your host, Dr. Mike Hutchinson. Today, wow, you've sent me a lot of questions, and I always appreciate that. And for new people, if you have a question on a topic I'm talking about or something you're interested in, please send it to drmikehutchinson.com, D-R-M-I-K-E, Hutchinson.com. There's a place where you can submit your question. I'll try to get back to it on a future podcast. And if not, I'll try to send you an email and perhaps give you some help. So today I'm going to get to some of your great questions. I have 3 pages of them, and I'll see if I can't cover some of these. But this first one is from Olivia, and it says, Dr. Mike, are all lumps on a dog considered cancerous by vets? Thank you for your advice. I love listening to you. Well, thank you, Olivia. I appreciate that comment. Well, I can speak for myself as a veterinarian. I don't consider every lump cancerous, but I do want to look at it, and I want to see the nature of it. Is it movable? Is it hard? Is it new? Has it been there for a long time? Is it ulcerated? Is it multilobulated? In other words, is it irregular? Is it, those are the kinds of things we want to know. Is it fast growing? Is it slow growing? Does it look like a wart? Does it look like a pimple? And so sometimes us vets don't know, and we want to stick a needle into it. We call it a fine needle aspirate to pull some cells out, put them on a slide, and take a look to see if it is cancerous. Because if it's cancerous, the sooner you find out, the better. The quicker to get it removed, the better for the patient, usually the better outcome. And sometimes that's the only way to diagnosis. The fine needle aspirate, I'd say, is about a 50-50 proposition. I don't think too many pathologists would disagree with me on there. I've talked to a lot of them over my career. But sometimes that can give you an answer pretty quickly, and we can tell you it's something not to worry about. And that's what we typically like to do. Fatty tumors, lipomas, technically they're a tumor. I have to say yes. They're abnormal growths of fat cells. They have their own stem cell, by the way, and if we were to use that for a stem cell treatment, they would end up growing more lipomas, so we don't use them, of course. But those are usually not a big problem on dogs unless they're getting really big or growing in an irregular area, like underneath an arm, on an earlobe, maybe on the wrist. Places like that, we might be more aggressive and say, let's get this off before it gets big because it's just a bad area or there's little skin there and we don't want it to become a problem later on. But for the most part, things like lipomas, fatty tumors that a lot of people are aware of if you've owned pets aren't a big deal to us. We just keep an eye on them, ask you to keep an eye on them, and take them off if they're becoming a problem, or if we're not sure if they're becoming a problem, then we're probably going to err on the side of removing it and finding out. So thank you for that question, Olivia. I'm going to go to another one. This one's about a cat. It says, Dr. Mike, this is from Tony and Jeff. It says, Dr. Mike, our cat has continuously had diarrhea for over 19 weeks, and she is slowly losing weight. Wow, that's a long time, almost 5 months. Our vet has tried everything she knows and said the only thing left to do is to biopsy the intestine at a specialist to see if she has cancer. We are mortified. Do you think stem cells, or asking me, do I think stem cells will help her condition? Thanks for any hope or advice that you can offer. Well, let me talk about diarrhea first. I happen to have worked with diarrhea for 5 years when I was in vet school. I worked with a virologist, and we were studying diarrhea from 1981 to 1986. And I saw a lot of different things. And chronic diarrhea doesn't necessarily mean that they have cancer. It doesn't necessarily mean that it's real bad news. It could be an inflammatory bowel disease, which is similar to Crohn's disease in people. What happens is the immune system turns against that intestinal lining, maybe because of an allergen in the food, or maybe because something's going awry, and it can cause inflammation resulting in diarrhea. And that diarrhea is the symptom of what's going on inside there. So when your veterinarian mentioned going to a specialist to have that biopsy done, I know a lot of veterinarians, we do that in our office. I don't do it a lot because we try to get to an answer without going to surgery if we can on those particular cases. But sometimes you do all of the tests, you exhaust all of your options, and you still don't have an answer or a conclusion of what's causing that. You've done the cultures, you've done all the things that we would think of, and we still don't have a resolution. So then we might want to go in and biopsy to find out what's going on pathologically. What are we seeing in that intestine? Is it inflammation? Is it cancer? Or is it something else going on? So to give you hope, would stem cells help that? If it were cancerous, I would never use stem cells because it's a contraindication. We're afraid that stem cells are repair cells, but we're afraid that they might go into that area and bring new blood supply. And if there's a cancer there, we don't want to do that, do we? So I wouldn't use stem cells on that. Now, if it was an inflammatory bowel disease that was non-cancerous, it might be a very good treatment, because one of the things that adipose stem cells do, stem cells from fat, is they modulate or calm down the immune system, or they can pick it up if it's an underactive immune system. But in this case of diarrhea, it would probably be hyperactive, and it can modulate that and calm it down and perhaps relieve those symptoms for a period of time. Individual results that I've treated before, we've gotten cats that have improved for 6 months to a year with one treatment. So there would be hope for that, but you would have to find out. There's also a blood test that a lot of veterinarians don't use. I use it before I go in and do any kind of intestinal biopsy on cats, and it's looking at an enzyme. It's called thymidine kinase, and there's a blood test that your veterinarian can pull and send out to the lab, and it also looks at an inflammatory marker that's called haptoglobin. I always get that wrong. Haptoglobin and thymidine kinase. And the two together can give an index that can let us know with pretty good certainty if there's cancer in there or not. And it's a reliable test in some cases. In some other cases, we get equivocal results, and then we have to go to the biopsy. But you might want to ask your veterinarian about that test, thymidine kinase, Kinase, and haptoglobin. And your veterinarian probably knows about it, and they may have already done that. But thank you for these questions. Next time, I'll try to get to some more of your questions. Remember, don't just live and let live, but live and help live.